I want to talk about a pattern I see regularly in my clinic and one that I think a lot of eczema patients don't fully understand. You have wet, weepy eczema, the yellow crusting, the skin that oozes when it flares. You treat it, maybe with other interventions, and it gets better. And then a few weeks later, it comes back in the same place, just as wet, just as stubborn. Most people assume this is just their eczema being difficult, and sometimes that's really what it is. But other times, the recurring infection isn't ordinary bacteria, and understanding the difference matters because the treatment strategy is completely different. Today, I want to get you from ground zero, why eczema gets infected so easily, all the way through to MRSA and the clinical clues that tell you how to understand the situation. Is it just recurrent eczema or MRSA? Before we talk about MRSA, I want to build up your knowledge base from broken skin to colonization to active infection, and finally MRSA at the end. One group of eczema patients at our clinic come in with wet and weepy eczema lesions. Some of them have very insignificant yellow crusting. For others, the yellow crusting is way more obvious. This is common in eczema, especially in discoid eczema. And we treat that successfully at our clinic. But some patients behave differently. For these patients, the lesions may improve partially and then recur again. Some may become chronically inflamed despite repeated treatment. In these patients, there is a good chance that it is MRSA or Methicillin-Resistant Staph A. MRSA is not the most common cause of infected eczema, but it is worth a discussion here. To understand better, let's go back to the beginning. Why eczema gets infected so easily? As we covered in a previous video, eczema damages the skin barrier. And once the barrier breaks down, bacteria enters more easily. As the bacteria enters, the skin gets worse and scratching creates more wounds. More wounds means further inflammation and the skin becomes vulnerable to secondary infection. This is why infected eczema is so common. Patients with atopic dermatitis often carry larger amounts of Staph A on their skin compared to the general population. The result is a familiar clinical picture. There is bad skin, it can be red, and the redness can spread. But more than that, there are these weepy lesions that end up being yellow crust. And this delays healing further. These are the people who enter our clinic, and a portion of them do pretty well with Chinese medicine. To some extent, your prognosis does depend on how much you've been over-colonized. So let's talk about colonization versus active infection. For some patients with eczema, the challenge is in identifying when bacterial colonization becomes clinically significant. Clinically significant means there is over-colonization. What I use as indicators of over-colonization include redness spreading actively, the skin turning crimson red, the infected areas getting warmer or hotter, the yellow ooze and crust becoming more significant. Chinese medicine actually does quite well, whether your skin is dry or if it's oozing or weeping like crazy. We see a spectrum of conditions from this to this to this and even this. And we are able to help even with the most scary of skin conditions. Many of the patients come in without having done a swab test, but most of the time it's likely just Staph A. What is Staph A? This is the most common kind of infected eczema. Most of these cases involve ordinary methicillin-sensitive Staph A. These infections often improve once the inflammation is controlled, scratching decreases, the skin barrier heals, and bacterial load drops. At the clinic, we may see superficial oozing and minor crusting that is aggravated by scratching. Many of these cases respond reasonably well to conventional TCM treatment, which is acupuncture and herbs, so long as they're not eczema herpeticum, impetigo, or MRSA. When do we suspect MRSA? MRSA should not even be assumed just because the eczema is severe. Suspicion rises when lesions repeatedly occur. The antibiotic courses come and they are repeated again and again. Weeping and inflammation may decrease to a low level, but then recurs and recurs again. The oozing and the yellow crust is somewhat chronic. Now, all of it sounds pretty bad. It does not prove MRSA, but it raises the possibility of resistant bacterial colonization. And that is often related to persistent reinfection. In these cases, the most useful thing you can do is a swab. A swab means getting a bacterial culture and then sensitivity testing for that culture to different antibiotics. The information is very, very useful. So here's a table for you to get a sense of what to look for if you're asking, why is my oozing, yellow crusting eczema such a forever thing? For me, the big thing is not so much how severe it is, how oozy or wet it becomes, but more that it keeps recurring and recurring. And that's when you need to think, maybe this could be MRSA. Clinical reality in chronic eczema patients. At our clinic, we see improvements using Chinese medicine to treat chronically inflamed discoid lesions. This is the most common type of presentation where it's wet and weepy. At times, our patients improve even when prior antibiotic treatments produce incomplete results. So these are the patients that seek our help when antibiotics work, but there's recurrence. And normally, if the infection is a Staph A infection, whether it's just mild colonization or very heavily colonized, there's a higher chance of positive effect when using Chinese herbs if it is normal Staph A. It doesn't matter if it's just skin that is broken with yellow minor ooze or when it's oozing like crazy. Chinese herbs do help. But still, you have to remember to reduce your inflammatory load, which is managing your dietary and environmental triggers. However, when lesions repeatedly return despite treatment, you may have to consider resistant bacterial colonization. We do help with this. Post-antibiotic reinfection. We are always on the lookout for this. And finally, MRSA. Summary. Weepy eczema lesions are caused by ordinary Staph A. They're common, recognizable, and often manageable. MRSA is different. It is resistant. The lesions tend to recur more aggressively, persist longer, and respond less predictably. The key clinical clue is not just how severe it is. The clue is chronic recurrence despite apparently reasonable treatment. This is where swabbing and antibiotic sensitivity testing can be useful. Anyway, hope this video was useful for you because it tells you a little more about MRSA and about how Chinese medicine may or may not work with different types of wet and weepy eczema. If you like this video, there's another one on discoid eczema right here. And there's one video here on what eczema is. Thank you for listening.